I'm Dean Leavenworth, and this is Community Forum, production of Time Warner Communications. On Parallax Forum, we deal with newsmakers and policymakers. On Community Forum, we'll be talking to people who are not in the news, but who are doing valuable and important work in the community. Our first guest is Billie Weiss, who's the Executive Director of the Violence Prevention Coalition. Billie, thanks for being here.
It's my pleasure.
We are in a violent society, at least that's the perception. People are afraid. People have a fear of crime that many people tell us exceeds the actual risk of violence. What is going on with crime today? Where are we relative to the past decade? Where is it going?
Well, actually, violent crime has decreased significantly, although we did have an increase in the year 2000, and once again in 2001, it looks like violent crime is increasing, particularly among in specific neighborhoods of Los Angeles. It's not all over. As a matter of fact, when you take away the neighborhoods that have seen this increase, which is the law enforcement agencies tell us is primarily due to gang violence, violent crime is down in the rest of the county. The difference, however, is what I deal with is violence and not necessarily crime.
What's the distinction?
Well, for example, when I talk about a homicide, I talk about the public health definition of a homicide, which means death at the hands of another. When law enforcement talks about homicide, they talk about somebody they can charge with a crime, and so there is a difference in what we talk about. And we also talk about child abuse and domestic violence, often are not reported as crimes, but they are still violence and still cause injuries.
Well, what are the main? What would you say if you had to classify? Here are the biggest risks or the most prevalence of violence that we're seeing in society now. What would those be?
Probably poverty is the biggest risk for crime, and the availability of a firearm. That's what takes an argument, which may be an argument between two people, and turns it into a lethal event. Having a gun there that's available.
How prevalent are firearms in society in general and in Los Angeles? Because I'd also like to see, how does Los Angeles fit into the bigger picture? How do we compare with the rest of the country, with other parts of California? Where are we?
Well, interestingly, in the United States, there are enough guns in circulation for every man, woman, and child to own a firearm. But that's not really what happens. Nationally, in national surveys, we've shown that about 30 to 40% of the population will report owning a firearm. In California, it's about 30%. These are from surveys. And a survey we did in Los Angeles County, the Los Angeles County Health Survey, actually showed that only 20% of the people polled reported owning a firearm. And even more interestingly, those who report owning a firearm are primarily, or the majority are, elderly white men. Those are not the people who get killed by a firearm in a homicide, but those are the people who are most likely to be killed in a suicide.
Huh.
And sort of the reason is because when you do these surveys, what you get are people who legally own firearms.
What's the proportion between, say, legally owned and illegally owned?
I wish I knew. We don't really know, but most of the guns that are used in gang violence are not legally owned weapons. And the Bureau of Alcohol, Tobacco, and Firearms is now tracing crime guns. And what they've discovered is most of the crime guns were originally legally purchased by somebody. And they were either acquired through a robbery, a burglary, or somebody sold those legally purchased guns, sold them illegally on the streets of Los Angeles.
Well, you've been the executive director of the Violence Prevention Coalition for 10 years.
Right.
So you've obviously recognized this, others have recognized this as a problem, and you're trying to do something about it. Can you tell us a little bit about what the coalition does?
Sure. The coalition is an organization of about 900 now, individuals and organizations, and they do things from arts programs for kids to gang violence reduction to mentoring. The law enforcement, the public health community are all there. And what we really do is come together to network, to use each other's resources, because clearly there isn't one strategy that can deal with it. an interesting other sort of aside is in the past years where violence has decreased majorly in major cities across the country, each of those cities, including Boston and Miami and New York, all had a different law enforcement strategy. But what they all had in common was they had a large community-based involvement in violence prevention using a public health approach.
So that's the approach that you're using here in Los Angeles is to multi-pronged and to get the community involved.
Right. What we really believe is that you need everything. Since most violence, particularly youth violence, occurs primarily in low-income areas where kids don't have the opportunity to go to the museums, they don't have the opportunity to go to the beach, they don't have a mentor or a trusted adult often in their lives, is to try and bring those things that make a nurturing community that may not be available to these young people through parents and families, to try and bring in those kinds of nurturing activities and create a healthy community.
I heard Councilmember Reyes this morning was talking actually about transportation, but he was talking about what his vision of Los Angeles was, and one of the things he said was have to stop saying inner city and start talking about historic neighborhoods. And he said we have to start getting enough activities in the neighborhoods for these kids so that they go and they swim, they go to the park, they play a sport, they go and do something else, and by the time it's nighttime, they go home and they're exhausted and go to sleep instead of going out and having problems. It sounds like that's part of what you're trying to do is provide alternatives.
That's exactly right.
Now, does that work? You hear people sometimes will find fault with that because it's so soft. You know, incarceration, punishment, that has kind of a healthy, solid ring to it to some people. Is this a soft solution or is this a practical solution?
This is a much more practical solution. Rand Corporation did a study that showed that prevention, good violence prevention works, and it's much less costly in public dollars than incarceration. If incarceration worked, this epidemic would be over. We incarcerate more people in the United States, and the state of California does more than any other state in the nation. If that worked, this epidemic should have been over. We have built 7 or 8 prisons in California since 1980. We've only built one institution of higher education, one state college in that same time period. It sort of doesn't balance out. It costs us about $30,000 to $40,000 a year to incarcerate somebody, and what does it cost to send somebody to a university? A lot less. For $30,000 or $40,000 a year, you can go to the most expensive university in the United States, and obviously our money is not being well spent by only incarcerating people.
Now, do you find resistance? Because I have seen some attitudes in society change even in the past 15 years where there used to be kind of a very, almost a thirst, a punitive hunger to say we've got to exact that pound of flesh. Have you found resistance or support, or has it changed over the past decade as far as looking at these alternative means of saying let's intervene early and often? What are you seeing in society and also in government? Well,
I think society does believe that we need to do prevention. There have been studies even about guns and locking guns up and the availability of firearms that have shifted. The general public does not believe people should own a firearm anytime they want one, nor should they carry a concealed weapon. That's changed. I think it's been a harder sell and continues to be a harder sell that prevention is a better place to put your money. Although the tides are beginning to change somewhat. I mean, the Little Hoover Commission just completed a study about what we spend on prevention in the state compared to what we spend in incarceration, and there is no comparison really. But I think government agencies are starting to take a look. We just passed Proposition 21, which was a very